Last year, I had the great privilege to go to the football stadium in Hoquiam with a group of the people that we work with down in Hoquiam at BHR, and walk arm in arm with a group of women who are survivors of breast cancer. It was probably the most powerful experience I ever had. And I thought to myself as we were walking around this field among thousands and thousands of people in celebration, what would it be like if we could do that with people who were survivors of mental illness?
And across the world, neuropsychiatric diseases are number 2 in the world in terms of lost life years. In the United States, neuropsychiatric diseases are number 1. They cause the greatest disability life years lost in this country. And of the top 6 diagnoses in that category, BHR treats all 6 of them. Last year, the data is available in 2002, there were 31,000 suicides in this country. 31,000 suicides. That's roughly one World Trade Center a month. And there's very little outcry. Nobody makes any noise about it. It often doesn't even get talked about because of the stigma associated with mental illness. But that's a huge issue. 31,000 lives a year lost to mental illness and sometimes to substance abuse. And if we can find a way to mitigate that, that's a lot of lives to be able to save.
It was my place of work, it was their place of living, and I really got to know them as people, and I really had the opportunity to understand the tremendous loss of opportunity and dreams that are associated with having a mental illness. So this is the courtyard of the gardens.
This is Stacy Sanders, one of many people who are definitely saving lives at BHR.
Symmetry going on. We want people to be able to sit anywhere and communicate with anybody.
The Gardens is a 34-unit housing complex for mentally ill residents.
So every other unit has a different color scheme.
Stacy helped design the Gardens so each resident could have their own rooms, their own bathrooms and kitchens, and dignity.
Refrigerator. I think that sense of home and that sense of permanency and safety that comes with having a home is part of being healthy.
This horse farm in Yelm provides transitional living for acutely mentally ill residents and BHR clients who have found new self-worth by caring for the animals.
Yep.
The alternatives are few, if any.
Well, I mean, it's the same old story. It would be no medication. It would be self-medication. It would be back to prison. It would be, no life at all.
Under a bridge.
Under a bridge, homeless, jails, institutions. It wouldn't be a life. And that's the travesty in it all. And that's why collaboration between different community groups is so essential, that not just one group, not just truly motivated, not just BHR can provide all the necessary things that helps these people out. It has to be collaboration.
We can't do a good job without the schools, without the family, without the probation parole officers, without the other community members, community collaterals as we call them, working with us. Because that whole thing about it takes a village, it really does.
There isn't a community meeting I go to, whether it's for breakfast or lunch or for dinner, where there isn't somebody from Behavioral Health Resources there helping to make the community a better place, giving of their own time and their own leadership. For instance, John Masterson is on the Choice board and is committed to my organization being financially sustainable and being able to provide services in the community.
I'm an alcoholic and a drug addict, and I was trying to get off the drugs and alcohol, and I couldn't do that because my emotions were up and down, up and down, up and down, and so I self-medicated. And I was extremely depressed, and I was hearing voices and seeing things. So through my doctor, she referred me to BHR, Behavioral Health Resources. They were like my best friends. I could call them anytime, my case manager, anytime, and she would always, always return my calls. She became my friend.
A significant number of our clients go through our programs, establish themselves in work or education, and move on, maintain abstinence, and move on to much better lives. We have a success rate for our type of treatment runs anywhere from as low as 45% to as high as around 65%.
Nobody is without hope. There's always a way if you reach out for help, and if people reach out to you and try to help you as well. This is a card that we produced that tells you about 12 of the children that have been born drug-free as a result of the Harvest program at BHR.
And I'm still active in Alcoholics Anonymous. I'm still sober, and I'll have 9 years in June. And now I'm a single mom, and I take care of my 5-year-old, and I'm engaged, and it's a great feeling.
I have a couple of great stories, and I'll tell you one of them about a Choice employee who was a mentally ill person who was so mentally ill that she was unable to work for about 7 years, and won the Phoenix Award, which is an award that Behavioral Health Resources does to help recognize people with mental illnesses becoming productive members of the community. And this person, after so many years of being so sick, was able to get employment. She actually worked here at Choice Regional Health Network after volunteering. Actually has moved on to work for Microsoft and is promoted over the last couple of years into very high, important management positions within Microsoft. And I know that in talking with this person that when she won the Phoenix Award, she felt like she was being recognized as being more than just a mental illness, that she was somebody who was important in this community.
That's why I love the Phoenix Award so much, because it celebrates the fact that people have risen from those ashes of mental health and addiction and are now really contributing back to the community. And that's why I love the Phoenix Award so much. They just, every year when we have that and I leave the Phoenix Awards, I am so grateful to have the opportunity to, oh, here I go. I'm so grateful to have the opportunity to do this kind of work, because I can't think of anything that would be more meaningful for my life. So
I'm thankful. I'm very thankful for everybody that has helped me, and for my higher power.
Oh, friend of mine, see your smile in every cloud that passes by. See you rise at night in every starry sky. You're the place that I call home. Something of you follows me wherever I do roam. Something of you follows me, lives in